So in Jacksonville, you have these 2 centers now that are operating. And I think this is a question that I hear. Can you have 2 proton centers in a market?
Absolutely, yes.
Why do you say that?
Well, there's 2 reasons I say that. Yeah. I've seen it work for one reason. I can tell you that. The second reason is right now, currently, if you look at the stats of how many people get cancer, let's talk about the stats real quick. 2 million Americans were diagnosed with cancer in 2024. 1 million of those need radiation per Astro and AdvaMed and other studies that have been done. All right. So 1 million need radiation therapy.
Right.
If you look at just Group 1 Astro indications, which really don't cover all the patients that really do need proton therapy, but let's just do a conservative analysis. So let's just say 20% of those need proton therapy. That's 200,000. Right now, only about 18,000 patients received proton therapy last year. So less than 2% of all radiation episodes are proton therapy, and only 9% of patients who need proton therapy have access to proton therapy. 9%, that's a very small number. So I know that even in Jacksonville, when people say, oh, Florida has too many proton centers, we actually don't have enough. I push back on that concept. Because if you really take that number of the 200,000, right now we only have 1 room per 3 million people. So we do need more capacity. We do have more studies that are showing the benefit. Now we have a study from Dr. Frank, who I know you're talking to soon to be published in the Lancet, showing an overall survival that's higher with head and neck cancers with proton therapy. So we need more capacity for these patients. So I push back very strongly on those. I also think patients need their choice, right? They need to know and choose between centers. Maybe they've been getting cancer treatments and they want treatment at that center. So there is room. And I think planning these 1-room centers in these regions is a great way to do that. And our academic centers and our hospitals are doing a really good job pushing out this research. We have a prolific research community. I mean, if you look at the research, we have over 1,000 studies just on proton therapy specifically in this community, and many more to come. And so our academics are doing a great job showing the evidence supporting where this technology best fits for certain patients. And our community centers are going to do a really good job delivering that care.